As you may already know, I've been a pharmacy technician for 20 months now. And a lot of times I hear through social media or personal experiences that we're simply pill pushers, that all we do all day is count pills. So today I'm going to disprove that. And according to CVS Caremark on their page Pharmacy Technicians, a lot of times we're the first interaction with the customer as they come to the pharmacy. And oftentimes during the prescription filling process, that would be a drop-off where we receive our paper prescriptions. The first thing we must do is ask for the patient's address and date of birth if it's not already on the prescription. Then we continue on to fill in the 18 data entry spots, which range from what the medication is, how we received it, the prescribed quantity, how many refills there are, the day supply, the doctor, and the time and day that they want to pick it up. Then we process the prescription through and it goes to production, where we print the label for the medication and put it in the appropriate basket. Yellow is for people who are waiting. Blue is for acute, which means that we receive the prescription electronically from the doctor and the patient will likely be in within the hour. And black is for everybody else who isn't waiting or didn't receive one from the doctor. We then go and find the medication according to the correct NDC. Multiple medications might have different NDCs because of different manufacturers. And to ensure that when we come back, we scan the barcode on the label and scan the medication, and if it's the right match, we will then be able to enter in our credentials. If not, it'll say scan failed. We then fill the medication and bottle it appropriately and then hand it off to the pharmacist to check. After the pharmacist checks it, we then bring the patient out at pickup. We ask them for their name and date of birth, and then we receive all the medications that they have and scan them out, and then they'll sign for their medications and pay for them appropriately. Besides the prescription filling process, we do many other things throughout the day, such as customer service, answering phone calls, and dealing with insurance companies. When we answer phone calls, we can talk to anyone ranging from other patients, pharmacies, and even doctors. We also deal with insurance companies when there's third-party rejects. Sometimes we either need to get patient eligibility, or a claim needs to get fixed, or we have to get an override if a patient lost the medication, or if there's some other reason that they need their medication. We also do pricing, so we price match to Walmart at my CVS. So sometimes patients don't want to use their insurance, or a medication isn't priced appropriately, so we price match that accordingly. We also do patient care calls, so every Saturday we get a new list of about 60, and we call patients to see if they need past due medications refilled, or if they have no refills on some of their medications. We'll call them and see if they're still taking the medication, and if they are, we'll see if they have an appointment coming up with their doctor, and if not, we'll see if they want us to fax the doctor to get them some more refills. We also have patients come back to the pharmacy that need help finding OTC products, which is over-the-counter products, so we'll go out and help them find that, or if they have any questions on if they can take the medication, we'll help them with that. Or they'll come for medications behind the counter, such as Coracine for cold and flu for people with high blood pressure, or pseudoephedrine for people who have colds. Besides that, we do other various tasks throughout the day. Every day there's a 14-day return to stock that prints out for people that haven't picked up their medications in 2 weeks. We'll go pull all those and we'll scan those in and we'll return them back to the shelf. We also file our prescriptions, paper prescriptions, every 100. We'll bundle those up and label them accordingly if they're non-controlled, controlled, or narcotics, and put them in appropriate shelvings. We then do inventory, obviously, so every Wednesday we receive our truck in and we will put all the medications on the shelf where they're supposed to go. We also have our outside vendor, which is Cardinal, and every day, Monday through Friday, we receive our inventory in that people that we didn't have on our shelves for people, and we'll scan those in and we'll fill the ones that we need to fill for patients, and the others will return to the shelf. We also do nightly maintenance that can include putting more paper and labels into the printer, restocking our bottles and caps, of all sizes, and also doing the trash, which we have 3 different trashes. The blue bags are for proprietary information for patients. That could be the labels, any insurance or social security numbers, and just any other papers we put in there. The green bags are for bottles, all of our medication bottles we put in there. And then the clear trash is for trash that we have if we eat or anything like that. So as you can see, we do a lot more throughout our day besides simply just counting pills. So the next time you go into a pharmacy, watch the pharmacy technicians and see all that they do.